Commissioner Marie Williams was reappointed Commissioner of the Tennessee Department of Mental Health and Substance Abuse Services by Governor Bill Lee in 2019. She was initially appointed to the position by Governor Bill Haslam in 2016. As Commissioner, Ms. Williams oversees and leads the department in its role as the state's public mental health and substance abuse authority with an annual budget of more than $400 million. She provides leadership and oversight to over 1,800 full-time positions that assist individuals to secure treatment and recovery services for serious mental illness, serious emotional disturbances, and substance abuse disorders. In all, the department serves approximately 350,000 Tennesseans every year. In her role as commissioner, Ms. Williams has served as a leader in addressing several essential issues facing Tennesseans, including the opioid crisis, emergency psychiatric services, and criminal justice reform. Commissioner Williams is the recipient of numerous professional and community awards, both from state and national groups. She resides in Nashville, Tennessee, and has a daughter, Nicole Williams. So Commissioner Williams, I'm going to turn it over to you. Thank you for being with us.
Well, I first want to start out by saying it's a true honor to be invited to speak to everyone. Some of you know I'm from West Tennessee. Actually was brought up in Crockett Mills, Tennessee, not far from Jackson. And my dad's business that he started in Jackson, Blue Hawaiian Pools, is now run and operated by my brother, Johnny Davis. So very excited about being able to be here. Wanted to tell you that the other thing that I've noticed, I've seen some names and people. I went to Dyersburg State Community College, and I actually saw President Boyer at one point on here. So President Boyer, so excited that you're part of this, and really, really grateful to be here. And then Mickey Whitaker. Mickey, I saw you, and Mickey is a longtime friend who is one of the founding members of NAMI, which is a National Alliance for Mentally Ill Individuals. So very, very good to see you, Mickey. And Jill, I want to thank you for allowing me the opportunity to be here today. Again, very, very glad you reached out, and it's been a joy getting to know you. So if we can get the slides going, the first slide has to do with what I've been asked to speak about as we've been struggling with COVID-19. And so you'll see that on that slide, what we're saying is that life is precious, powerful, and purposeful. And so I will be speaking today about that and about what this great state of Tennessee is doing. On the next slide, what you'll see is a familiar song, Lean on Me. The reason we've got that song up there is really it exemplifies what I believe many people have been struggling with. That song, sometimes in our lives, we all have pain, we all have sorrow, but if we are wise, we know that there's always tomorrow. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm going to need somebody to lean on. And so when we look across this state, as we've been struggling with how to best respond to COVID-19, on the next slide, what we'll see is the common questions that people have had. Those questions have included personal questions that many of us have asked ourselves. Am I going to get sick? How can I prevent the spread? What happens to my job? Our family questions. How do I provide for my family? How can I stay connected to my relatives? How can I care for my children and continue their education? And then community questions. How can it be safe to go out to the public? And will things ever be the same? And we know as those questions have come up that there are common mental health impacts that are shown on the next slide. And those impacts are really important for all of us to know. And I really hope you'll take these impacts in, that it's natural to feel anxious, overwhelmed, fearful, depressed, or even angry. We know that people that have existing mental health issues may feel their symptoms getting worse right now. And we know people with no previous diagnosis may have developed one in reaction to the virus. And one thing we know for sure is that there's been an increased use of alcohol, tobacco, and other drugs. So if you go to the next slide, one of the things that we talk a lot about is a incredible woman, Dr. Virginia Satir, who was a pioneer in mental health work. And on the next slide, what you'll see is something that she talks about. It's the Declaration of Self-Esteem. And in that declaration on the next slide, where she says, it's okay to not feel okay. You are not alone in this, and you don't have to suffer the burden of anxiety and fear by yourself. So on this, what I'm going to go through are some statistics that have to do with what we've seen during the COVID-19 epidemic related to reporting symptoms of anxiety and depressive disorder. You'll see on that slide that in May and June and July, we've gone from 34% of symptoms of anxiety and depression up to 40% in July. That was conducted by the Kaiser Family Foundation. If you go to the next slide, if we break out of that, what Kaiser Family Foundation has looked at, they also have looked at the population of individuals that are 65 years or older. And that population says that they have worried or they have had major stress related to the coronavirus, and it has had a negative impact to their mental health. I want you guys to look at that because in March, it went from 27% up to 47%. I know in my family, I've heard from individuals, aunts and uncles who have said, you know, the longer this goes, the more afraid and worried I get. And we're still trying to figure out when will there be this end in sight. So our data reflects that. If you'll go to the next slide that looks at the percent of adults who say that the worry or stress related to the virus has had a negative impact on their mental health or job or income loss, which is something that I know that all the chambers are very, very focused on, you'll see that 58% have had a concern and 50% have had a concern, whether it had to do with their self, their spouse, with lost job or income, looking at different periods of time. If you'll go to the next slide, you'll even see that the impact on health status, 51% and 62% have been struggling with health based upon the impact of the COVID-19 virus. Then if you'll go to the next slide, what I put together for you has to do with the behavioral health impacts of COVID-19. During late June, 40% of US adults reported struggling with mental health or substance use. 40%. That means today that if there's 60 people on this call, that we have almost 30-something people that are struggling, or a little under 30-something people that are struggling with a mental health or substance use concern. And what's really concerning is the seriously considering suicide. That's gone up to 11% of individuals that have actually seriously considered suicide. If you go to the next slide, and it's the final slide that gives you information related to Tennessee. This Tennessee poll was taken by East Tennessee State University. Dr. Randy Wyckoff is an amazing researcher and leader. And I want you to see what it says in Tennessee. You'll see on that slide to the left that 53% of Tennesseans reported being nervous, anxious, on edge 7 days prior to taking this survey, which was done between April and May. You'll see that 50% reported trouble sleeping. You'll see that 43% reported feeling depressed in the 7 days prior, and almost 43% said that they were feeling extremely lonely. Now, when we look at those all combined, what's so important to us as business leaders and as friends and as family is to recognize what are the signs of depression. So if you'll go to that next slide, Jill, when we're looking in our businesses and work, we really do know some common indicators of depression. If you see people around you or you yourself are feeling persistently sad, anxious, or empty, and persistent means for like more than 2 weeks. So if you've got a solid 2 weeks of that feeling, that's a sign. If you're noticing that you're sleeping too much or you're sleeping too little or you're waking up in the middle of the night or early in the morning and you're having a hard time going back to sleep, that's a sign. Reduced appetite and weight loss or increased appetite and weight gain, that's a sign. Loss of pleasure and interest in activities that you've once enjoyed, that's a sign. Fatigue or loss of energy, feeling guilty, feeling hopeless, or feeling worthless. And then finally, thoughts of suicide or death. All of those are like very high indicators that a person is dealing with some depression. Now, we know, according to the next slide, that when we're dealing with depression, that there are ways in which we can respond to those symptoms. And I want to go over those with you today. One is to seek out a peer or a group support and just say to someone, hey, I'm really struggling with this. I'd like to talk with you about it. Lifestyle changes, dopamine really gets increased when we exercise. Talk therapy, psychotherapy, counseling. I really hope that if you are with an organization that has an EAP program, that you are yourself reaching out for help and you're helping your staff and your associates reach out for help through your EAP, and then exploring options with your primary care physician. It is really important to say, hey, I'm struggling if it's persistent. Treatment works. We know that medication does help with recovery, and when you wrap that around with therapy, that also helps. The next thing that we're seeing in the next slide is signs of anxiety. And that's another reaction, a normal reaction to what's happening with COVID-19. And in those signs, if you're noticing yourself or others feeling tired or irritable, difficulty concentrating, muscle pain, tightness or soreness, difficulty sleeping, falling asleep or staying asleep, all of those signs, if they are prolonged, and so we're talking about not off and on, but like prolonged, 2 weeks or more, all of those signs say at that point we really need to respond to the anxiety. The next slide goes over ways in which we can respond to that anxiety. One is to take a break from watching, reading, or listening to news stories. I myself have had to do that. We get what we give, and what we put into ourselves is what we ruminate on. So sometimes just take a break from it and put things into your mind, into your soul, into your spirit that are positive. The other one is taking care of our body, meditating, taking deep breaths, eating healthy, well-balanced meals, exercising regularly, getting plenty of sleep, and then paying attention to whether or not you're using alcohol or drugs to self-medicate. And I want to say that again, whether or not you're using those to self-medicate. If you are, please reach out for help. Please connect with others. And you'll see that the next slide talks about if we are doing that, Here are the signs of substance abuse to pay attention to. If you find yourself or someone else continuing to use drugs or alcohol, even if they're a negative consequence, and you find out that you're using more and more drugs to get a good feeling, or alcohol, if you try to stop but you find it difficult, physically or emotionally feeling like you need to use drugs more than normal, finding that you're spending more and more time trying to find drugs and alcohol, and if when you stop, you start having withdrawal symptoms, trembling, hallucinations, sweating, and high blood pressure, again, it's time to really take stock and say, hey, I get to start a new day. My family can start a new day. And if you'll turn to that next slide, you'll see things that we really recommend to respond to those signs. You'll see that quote by Theodore Roosevelt, believe you can, and you are halfway there. So being honest about the problem, a family friend intervention, seek help, talk to your doctor, examine treatment needs and options. I would really encourage you to look at the next slide, which talks about connecting to substance abuse help. We've given you the resources here. These are things that have been funded so generously in many cases by the governor and our legislature. So calling or texting the Tennessee Red Line, 1-800-889-9789, that's a free 24-hour, 7-day-a-week referral to addiction treatment. I mean, if you have nothing else, take that number and you can give that to people if they're trying to find out where to go get treatment. Recovery support resources in our communities, AA, NA groups, our faith-based initiative that we've been running, where we have faith-based coordinators across the state who are focused on helping others that are struggling with addiction and mental health issues. You'll see the Lifeline Peer Project Coordinators, Tennessee Recovery Navigators, Regional Overdose Prevention Specialists, Substance Abuse Prevention Coalitions. What I'd say on those is that if you'll go to our website that we're going to show you in just a bit, and go to these are people that can come to your businesses and they can talk to your groups, they can talk to your employees, they can talk to you. They are out there, they are funded to be able to help, assist, and really partner to get people into treatment. I cannot say enough positive things about these individuals and their work. If you go to the next slide, you'll see that singer-songwriter Shawn Mendes talks about ways in which we can take care of our mental health. Again, it's very similar to what we've talked about. Items like allowing yourself to feel and breathing, calling or FaceTiming friends, staying physically healthy, and then meditating daily. The next slide has to do with the power of spirituality and meditation. If you have a spiritual life, a connection to God, you know that these practices and this connection can allow us to have practices that will disarm fear and uncertainty while helping to present and sustain hope. These practices include active listening, finding hidden strength, embracing solitude, and valuing repetition and routine in our practice. Whether that's morning meditation or evening meditation or in the middle of the day meditation, you'll see on that side the quote, be patient, bear the burdens of others, and practice mercy, are all values around spirituality and a walk with God. If you'll turn to the next slide, we've given you a couple of websites that you can go to and find ways in which that you'll be led through meditations for relaxation and stress relief, healing, self-esteem, and spiritual awareness. If you'll go to the next slide, you'll see the key takeaways around personal mental health. And they really are taking care of the basics: hygiene, sleep, food, and connection to others, talking to someone that you truly trust, offering support to others, staying informed, but not letting that consumption of news affect you, and then asking for help. All of that is really, really key. Before I continue, I'd like to ask, are there any questions that anyone has that you'd like me to answer? Okay. Someone asked what the meditation website was. We'll get you the slideshow, and you'll see that that actually is there. It's Fragrant Heart Meditations. So that's a really, really good slideshow. All righty, not slideshow, sorry, meditation website. If we can move on to the next slide. When we're talking about COVID-19 family concerns, what we'll see, there's questions around how do I protect my family from illness? How do I provide for my family? How can I stay connected to my relatives? And how can I care for my children, support their education while I'm doing my job? I've heard from so many people about how they're really struggling with balancing all of this. And I really want to say that your efforts and your willingness to try to balance this is really half the battle. And just reaching out to your friends, your family, and asking for help when you need it is really important. Would encourage that. If you go to the next slide on notes for parents, I know that some individuals are saying that they're seeing that their kids may be crying or irritated more, that there's worry or sadness, unhealthy eating or sleeping habits. And the way in which you can truly support your kids is on the next slide, and it's notes for parents, ways to support your child. That next slide talks about just talking with your child and being honest about what's going on in an age-appropriate way, reassuring them that they are safe, and sharing with them how to deal with stress so that they can cope. You know, taking a walk with your child, going out and playing in a socially distanced way with your child is really something that can be done and be very, very helpful. And the other thing is limiting the exposure to any kind of negative information, as well as being a role model by taking breaks, getting plenty of sleep, and exercising. If you'll go to the next slide about connecting to mental health help, again, can't say enough about health insurance phone numbers. Make sure you have them, employee assistance programs. We also have a 1-855-274-7471 crisis number. These are crisis mobile units as well as crisis stabilization centers that are run by local community behavioral health centers all across the state. Call that number, you'll get an answer and somebody can help you. As well as if you'll go to our website, we really have worked hard. Matthew Perriott, who's our Director of Communications, has worked very hard to have a website that's user-friendly. It is really an incredible website, chock full of information and resources to go to if you need them. If you'll go to the next slide and you look at the state and the community provider response, we've done a whole lot in this state. Governor Lee led the effort, and the legislature absolutely went and supported the effort about expanding telehealth so that we can maintain engagement with clients and ensure continuity of service. We've worked with providers and TEMA to gather PPE requests and arrange for distribution. We've applied for in our department and secured multiple grants that have gone out to our providers to be able to continue to serve Tennesseans during COVID-19. If you'll go to the state TDMH SAS community provider response, you'll see that there's been an increased effort related to naloxone distribution across the state. in the earlier slide where we talked about regional overdose prevention specialist. Those individuals would be absolutely happy to come and talk to your work group about naloxone and how that can help save a life. We've supported the needs of school-based behavioral health. The governor and the legislature have approved the expansion so that we can have a school-based behavioral health liaison in every county. Jill, if you'll go to that next slide where we're talking about the state allowing us to be able to use non-licensed professionals and clinicians under the supervision of a licensed clinician to be able to provide mental health help. That has been really important. And then finally, partners in the community of mental health professionals. We've launched a COVID-19 emotional support line for healthcare workers and first responders. On the right, you'll see Diane, Kristen, and Amy, who are in Jackson, Tennessee, and they actually work with the Prevention Coalition, and each of them are lifeline providers and recovery navigators and regional overdose prevention specialists. On the low cost, high impact possibilities that the governor's funded, if you'll go to the next slide, what you'll see there is we really have come far in this state to serve individuals that are uninsured. So as of this year, we have programs through the Behavioral Health Safety Net, which are on the next slide, that provide essential mental health supports for uninsured children. They provide linkage back to TennCare and Cover Kids. That is key for kids that might be struggling and their parents. And if you also look at the adult safety net, you'll see that all of those really focus on those steps that we can all take. That I'm just so, again, grateful for a state that has really invested in services and supports for individuals that need those. Last year, the Safety Net for Adults served almost 40,000 Tennesseans that were 138% of FPL or below, and that was done through your community mental health centers. And just it's created a great sense of foundation and support for individuals struggling. If you'll go on, Jill, because of time, to the slide that starts with back to the Tennessee poll. What you'll see there is Tennesseans are hopeful about the future. And that's important because without hope, we really feel lost many times. It says that the Pew Foundation found that 50% of respondents did feel hopeful. And in the ETSU poll, that 65% of Tennesseans felt hopeful about the future occasionally or most of the time. That's something to celebrate, something very important to celebrate. And so the next slide talks about the bottom line right now. We know that masks are so important to fight this virus. So wearing a mask to fight for small businesses, this is a campaign that we've been doing across the state. We know that that will help everyone. And then if you go to the following slides, Jill, I know that you're going to have these up for individuals. We've got condensed hotlines for help. The next slide is trusted sources of information that you can go to and get more information outside of our website. You'll see screening tools slide that talks about ways in which you can screen or help an individual screen for anxiety, depression, substance abuse. Parents, youth, and caregivers can all use that slide and go to that website for that information. And then we've got an appendum of helpful resources that you can go to, click on to get more help. In closing, the final slide, Jill, we know that we will all get through this together because we know that we're Tennessee tough, we're Tennessee strong, and we're Tennessee true. And it's my hope and wish that God continues to bless and keep you and us all. And Jill, I think I've come in under time, which I'm grateful for, because I wanted to make sure that I kept you where you wanted me to keep you. I'm going to turn off my alarm. And with that, I'll turn it back over to you all. Thank you so much for this opportunity to share.
Commissioner Williams, thank you for being with us. We appreciate it. Good, very good information in a very uncertain time that we're in. So thank you for taking the time to be with us.
Thank you.
Everyone, we just want to thank all of you for joining us today, taking this hour out of your busy days, and especially our neighboring chambers that came to be part of this today. We appreciate you. Again, always our sponsors: Commercial Bank and Trust, North Star Medical, Roberts Jewelers, West Tennessee Women's Center. Thanks for their support. And everyone, be watching your email for another upcoming event announcement, hopefully pretty soon. And we look forward to seeing you next time. Thanks for your patience with some of us who might have had a bit of technical difficulty there. Sorry about that. Anyway, have a great day. Thanks for being part of this.